Good afternoon. Secretary General will make some remarks, and then we'll take one or two questions. So.
Good morning, ladies and gentlemen. It's a great pleasure to see you. I have just convened the UN system-wide meeting on the response to the Ebola crisis in West Africa. Having just returned from the region yesterday, I wanted to share my observation with our principal leaders of the organization and make sure that the UN response is rapid, effective, and comprehensive one. Ladies and gentlemen, Ebola is a vicious killer. I went to the region to show solidarity and to thank the courageous health workers who have inspired the world. In my talks with the presidents of Ghana, Liberia, Sierra Leone, Guinea, and Mali, I thank them for their leadership and stress the need for continued vigilance. I also want to express my great admiration to Dr. Margaret Chan, the Director General of World Health Organization, and Dr. David Navarro, my special envoy, and Mr. Anthony Bamburi, a special representative and head of UNMIA, who all joined me on this trip. I met with international, national, and civil society partners and thanked them for being part of a remarkable global mobilization of support. I also had a chance to personally thank UN personnel who are doing such a valuable work on the ground, risking even their own safety and security, including those serving in UNMIA. I also spent time with the local doctors and others who are the cornerstone of the response to Ebola. I had an especially memorable and moving encounter at a local Ebola treatment unit in Sierra Leone with a nurse named Rebecca Johnson, who contracted the disease, survived, and then immediately became a caregiver again. I also met other patients at the same unit who had been cured from Ebola and proudly showing their certificate that they were cured completely from Ebola. Nurse Johnson's commitment should move us all to do more to end the outbreak and to stop the stigma that she and so many victims and caregivers face. During my visit, I saw the progress that is being made. The rate of transmission is slowing in many places, where the strategy of isolation of the patients and treatment, contact tracing, and safe and dignified burial is implemented. It is working. Same areas that were once a hotspot, such as Lofa County in Liberia, have been free of Ebola for weeks. I was inspired by the sense of ownership shared by the leaders of the government and the people. Everywhere I went, at the airport, the presidential offices, the treatment centers, everywhere, I had my temperature checked and washed my hands in chlorine solution and followed all other precautions. That means everybody is now going by health protocols. At the same time, I emphasized that despite inroad, Ebola remains an emergency and there can be no let-up in our efforts. 4 steps are especially urgent. First, we are adapting our approach to fit the emerging picture of the crisis. Instead of one outbreak spreading relentlessly from the epicenter, we are now seeing dozens of isolated chains of transmission. The outbreak is evolving, and so has our response. Second, we are increasing emphasis on hunting the virus. This operation involves teams of doctors and nurses, lab technicians, and epidemiologists able to deploy to the remotest area to increase treatment and tracing. National governments, communities, and health doctors will play a central role. Let us remember that the affected areas is very big, larger than the United Kingdom, and home to millions of people, and we cannot afford to miss a single case. Third, we must step up the recovery efforts now. That means restoring essential services, getting children back in school, getting people back to work, rebuilding shattered economies, and caring for thousands of orphans. Fourth, we must learn the lessons of Ebola, which go well beyond strengthening public health systems. The international community needs better early warning and rapid response. I intend to engage member states in a serious effort to explore what more we can do to stay ahead of the next outbreak of disease, a test that is sure to come. Today, our immediate goal is simple: 0 cases. Even 1 case can trigger an epidemic. Over the past few days, I witnessed immense suffering. Ebola is a terrible disease that denies the humanity of its victims and stigmatizes its survivors. But I also saw almost superhuman acts of kindness and support. My presence in the office today is meant to send an important message. Where people saw no symptoms, others should follow no fear. Others should show no fear. Ebola caregivers should be praised, not shunned. People who have traveled to Ebola-affected countries and have no signs of infection are no threat. I also repeat my call to avoid travel restrictions, border closures, and other counterproductive obstacles. As we fight the Ebola virus, it is equally crucial to combat the contagion of fear. I thank the many countries that have stepped forward with generous contributions of people, equipment, and funds. If we are to win this battle, we need even more life-saving solidarity. I encourage the world to continue stepping up. I thank you.
Thank you, Mr. Secretary General. You said that lessons need to be learned and that you're going to be asking the member states. Do you have any suggestions of what they should do?
First of all, we still need much more resources and help for those countries and people affected by Ebola. Human resources, medical doctors and nurses and health workers, and the financial support and equipment and logistical support. I have seen such generous supports are coming not only from government but also from many NGOs. And these support are coming not only from developed world but many developing countries. This is quite moving, and this is a true face of humanity, and I fully appreciate this one. But since our strategy is working and this curve has been bent, it's going down, but not fast enough. We have to make this curve downward fast so that we will see zero cases. I have been urging United Nations system as well as countries concerned that we should make this a short-term goal, not even mid-term goal, so that we can finish it off as soon as possible. For that, we really need continuing support. I am very much grateful for such support. I know that member states, in a sense, very much spread on this giving aid. We have so many crises, starting from Syria and many humanitarian crises in Africa. But this is a very short-term goal that we can do it now.
Secretary General, strategy against the disease are working, you just say. I'm sure that those people that you made, those authorities that you made, has told you about some challenges that they are facing on the ground. Could you give us some detail about those challenges that they are facing, beside the fact that everything is on the right way?
Strategy on the international part and civil society part, I think we've been trying to mobilize all what we need to do, as I have just said, but we need more. Then I have been urging the leaders of the concerned countries that now, as we have been going through a first phase of immediately addressing this one, and now as we are seeing some downward trend, now it's time for countries to think about the recovery strategy. UNMIR is not mandated about this recovery, but I have asked this morning whole UN development agencies led by the UNDP to help those countries to plan the recovery. They have been profoundly affected in socio-economic areas. And there's a lot of trade restrictions and travel restrictions, import and exportations. Therefore, we need to think about that. On the part of countries affected, there is a lot of things for them to do in coordination, in parallel with what international community is doing. I have been asking leaders that please take ownership in social mobilization. And there is some huge issue of culture and tradition. And this culture and tradition is a very, very good tradition, a 1,000-year-long tradition. But this Ebola virus is a very unique and extraordinary nature of disease, which we have to cut it off as soon as possible. Therefore, just a safe and dignified burial, that really helps greatly. As you know, the United Nations has been campaigning this for what we call 70% to 70% strategy. That has been largely worked. Whenever there are some patient or suspected persons who are showing symptoms, should be immediately isolated, separated from families, and get the professional medical support. And when somebody dies, unfortunately, then they should be dignified way and safe way to be buried. But because of lack of such practices, we have seen unexpectedly much more new cases. But now, largely, we are holding, in some cases, 80% of this policy guideline has been kept. Now, our target is 100% to 100%.